As you know, we're entering a period of unprecedented environmental breakdown. Human activity is changing the planet's biosphere and bringing disruption to planetary health in the form of climate change, ocean acidification, deforestation, and loss of biodiversity at a drastic rate. And as the Parliament's Environmental Audit Committee said only last week, everything you do to the planet, we do to ourselves. So it's very obvious then that climate change undermines the very foundations of our health. And we're experiencing this in cities all over the UK right now and all over the globe. We've already talked about air pollution, killing millions of people globally and annually, and it's one of the biggest contributors to climate change. But also, I think air pollution is immoral. It's one of those things that you have no choice and control over, the air you breathe. And small particles enter your body in a way that's damaging every organ and virtually every cell of your body. Research shows that it does affect you from head to toe, from the things that you probably think about, from damaging your heart and your lungs, but right through to diabetes, dementia, liver problems, bladder cancer, brittle bones, and damaging skins. And also it affects fertility, fetuses, and children. They're so affected by our toxic air. And this systemic damage is the result of pollution entering your body, causing inflammation that floods around your cells and ultrafine particles being carried around the body into your bloodstream. So it's no surprise then, for example, in London, air pollution is the second most significant factor in defining your health after smoking, causing 9,000 premature deaths a year. And this is repeated in our cities up and down the UK. And then there's extreme weather. The NHS doesn't talk about winter pressures anymore, it talks about summer pressures too. When we experience temperatures like we saw recently in London and across Europe, it presents itself in our A&E departments and in other healthcare systems. Extreme heat is really dangerous, shutting down lots of organs in your body, and it's particularly dangerous if you're young and you're old. And last summer's heat wave accounted for nearly 1,000 excess deaths alone. So climate change is shortening the lives of people in the UK, but that's nothing to what's happening globally. As ever, those least able to protect themselves, the poorest, are disproportionately affected, and they're the people contributing least to the carbon footprint. So negative consequences on people's health is growing and is set to become catastrophic if we continue as we are, which is why the World Health Organization has described climate change as the defining health issue of our time. Health professionals have a duty to protect and promote public health in the face of these threats and have a unique and vital role to play. Their expertise, the diversity of their roles, and the trust invested in them by the public mean that they should and could be leaders championing health when we talk about how to mitigate climate change. And we know that things that protect the planet and mitigate climate change are also good for our health. Phasing out polluting vehicles, for example, reduces air pollution while enabling us to replan our cities, adapting them to cope with extreme weather, increasing people's ability to be able to walk and cycle around them and support them to use public transport. The opportunity for health to improve when we transform our cities and our green spaces is game-changing. But transformation takes time, and we're late to start, and we have to catch up very fast. The UK's leading health bodies have come together under the banner of the UK Health Alliance on Climate Change to do that. They include the BMA, the RCN, many medical royal colleges like physicians, surgeons, anaesthetists and psychiatrists, the faculties like the Faculty for Public Health, but also our two leading medical journals, the BMJ and the Lancet. And together we advocate for responses to climate change that protect and promote public health. Our vision is that threats to planetary health from climate change are minimised in a way that public health benefits are maximised. But there's a twist in the tale. Ironically, healthcare systems make us sick, in stark opposition to the medical ethics of first do no harm. The healthcare sector is a major contributor to the climate crisis. Healthcare's climate footprint is estimated to be 4.4% of our global net emissions, and 5% of UK emissions. And if healthcare was a country, it would be the fifth largest emitter on the planet. And it's kind of not surprising. The NHS is an employer of 1.6 million people, is a purchaser to the tune of 20 billion. It has estates and lots of unused land, and it accounts for 3.5% of the road use in the UK. And as such, it counts for 40% of public sector emissions. So what can be done? We see some hospitals, for example in Newcastle, declaring a climate emergency. We see colleges that are my members divesting. We spend trillions of pounds on fossil fuel subsidies that make us ill. We need to increase our carbon literacy because empowered we can decarbonise and make ourselves and other people well, and we really need to look at those supply chains which account for 70% of our carbon footprint. We know that healthcare professionals care about this. We must get to net zero greenhouse gas emissions before 2050 and as soon as possible. But this is a huge societal shift, and health will have to play a vital role in getting this done. And it has done in the past, as it has done with kind of unhealthy behaviours like smoking. It needs to take that leadership role. To catalyse change in our attitudes and behaviours as individuals, members of communities and organisations, and as a country, healthcare professionals need to lead by example. And many doctors are all doing this already. We've just heard about social prescribing, referring people to kind of non-clinical community-based support interventions. And there is a greater awareness of the impact of healthcare on the environment, leading to an increased uptake in environmentally friendly pharmaceuticals. For example, with asthma drugs, where dry powder inhalers avoid the most harmful propellant gases used in standard equivalents. And all healthcare professionals have an interest in keeping you well. If you're a surgeon or an anaesthetist, for example, we want you as fit as possible before you undergo any procedure. And often they prescribe walking as a way of getting fit, because as you probably know, walking is a wonder drug. It can dramatically reduce the risk of heart disease, strokes, many forms of cancer, Alzheimer's and type 2 diabetes. And physical inactivity is responsible for 17% of early deaths in the UK, and a staggering 1 in 3 adults walk less than 30 minutes a week, resulting in a whopping 37,000 preventable deaths if people walked a bit longer every year. And this day-to-day activity is vital, as opposed to the kind of activity that you might do if you go to the gym. It's particularly important because on average, European adults now expend 500 fewer calories every day than they did 60 years ago. And changes in lifestyle in this period have led to a reduced physical activity equivalent to running a marathon each week. And that's a pretty stark indicator of how sedentary our cities and our jobs have made us now. And all of that has come at the change has come from carbon guzzling technology. So leaving aside the societal structured support that we need to get people out and walking, our urban areas don't often support active lives. So buildings and places need to change. And too often our cities have been designed around cars while green spaces have been neglected or squeezed out altogether. We desperately need neighbourhoods that put walking and people walking and cycling first and allow easy access to quality green spaces from our front door. And even though you're probably thinking, well, we've got this now, we've got cycle lanes, we've just had car-free day in London. You're designers and planners and architects, you know this, but there isn't great news. Since 2002, cycling has accounted for just 2% of all trips made in England, and the average number of cycling trips has decreased per year. And walking, trips made on foot, that's remained fairly static, so we're not getting through to those people at all on that message. So places need to change. They need to be transformed to support health and mitigate climate change. We need cities that take overheating seriously, housing policy that really considers ventilation. Indoor air quality is often worse than outdoor air quality. We need to green our cities, and we need to build them so we walk our children to school. For people's health and to drive us to meeting our net zero targets, we need to build communities that are high enough density to support local amenities, enabling people to walk and mingle with each other. And we know this can be done. In the car-loving city of LA, for example, this has been done to reduce car use by about 30%. We need to improve the options to walk and cycle and use public transport, and we need to ensure street layouts put active travel at its heart. And we just need to design places so that healthy, active, sustainable travel is a choice and the easiest choice you can make. Many of you in this room know how this can be done, and healthcare professionals know how important and enormous the benefits will be to our health and the climate. We stand shoulder to shoulder with policymakers making those very difficult decisions, with private companies and communities where they are trying to deliver this change. We got the momentum, we have the legislative framework now, but now we need to make it happen. Thank you.